It is a great satisfaction to greet you again. I hope you and your pet are well. Today we will talk about the following. What to do if your pet is bleeding. A bleeding wound on a pet can be a scary and stressful experience for both the owner and the furry family member. Knowing the best way to approach your pet and provide first aid for bleeding wounds can help you care for your cat or dog even in the worst situations until they can receive veterinary care. 1. What happens when a pet bleeds? Bleeding is the loss of blood from the circulatory system. Your cat or dog may bleed if they suffer an external injury, an injury that occurs on the outside of the body, that breaks the skin and sometimes the layers of tissue underneath. Some common injuries that can cause bleeding include abrasions, a scrape in the skin, lacerations, a cut or tear in the skin, puncture wounds, a foreign object, such as a stick, pole, dog bite, spear, or fishhook, that becomes lodged in an area of your pet's body. Your pet may also suffer from internal bleeding, which occurs when trauma or a toxic substance causes blood to leak from the circulatory system into the body. 2. When is it necessary to go to the vet? It is recommended that you seek veterinary medical attention as soon as possible for any signs of internal bleeding, such as coughing up blood, pale gums, acute weakness, collapse, nosebleeds, black, tarry stools, or any external bleeding on the skin, as home first aid and bandages are not a substitute for professional medical care. Your veterinarian will be able to assess the cause of the internal bleeding or perform an aseptic cleaning and remove any possible debris or foreign objects in a skin wound. Your veterinarian may also give your pet any necessary antibiotics, pain relievers, or anti-inflammatories. 3. How to approach and treat an injured pet. An injured pet may act scared, nervous, or even aggressive due to pain and trauma. Try to follow these steps when approaching an injured animal. Approach slowly and cautiously. Try to calm the cat or dog as best you can. Restrain your cat or dog by wrapping it in a thick blanket or towel or putting a muzzle on it before tending to the wound to prevent any possible bites. 4. What to do if your pet is bleeding. Until you can receive veterinary care, it may be possible to stop the bleeding with these first aid steps. If your pet is bleeding from a wound, immediately apply gentle, direct pressure to the bleeding area using gauze, bandage materials, such as a non-absorbent pad, or even a clean cloth if you don't have bandage supplies on hand. Hold the cloth or gauze over the wound to allow the bleeding area to form a clot. If the wound begins to bleed through the material, you can add additional layers of cloth or gauze on top, but do not remove layers because this can disturb the blood clot and cause more bleeding. It is important to note that any bandage that is applied too tightly can restrict blood flow, which can lead to swelling or even tissue necrosis, death, which can be a serious medical problem. Apply pressure to the supplying artery closest to the wound or affected area. Do not pull or remove anything lodged in your pet's body. Instead, try to stabilize the object. If it is an extremely long object, you can try shortening the end by a few inches. Encourage your cat or dog not to move and to remain as still as possible. Placing a tourniquet is only recommended in serious life or death situations, as an improperly placed tourniquet can be extremely dangerous and lead to limb amputation or disability. A serious bleeding injury where a tourniquet would be warranted is if the wound is actively oozing blood. 5. What is internal bleeding? Not all bleeding occurs on the outside of the body. Sometimes trauma or ingestion of toxic substances can lead to internal bleeding inside the body. If not treated as soon as possible, it can lead to shock. Blood loss of as little as 2 teaspoons per pound of body weight is enough to cause shock in a cat or dog. What are the signs of internal bleeding? Physical signs of internal bleeding may include pale gums or white or blue color. If your pet's body, ears, paws, legs, etc., feels cold or cool to the touch. Unusual lethargy or tiredness, not moving normally. Coughing up blood. High heart rate with concurrent low blood pressure. It is important to apply first aid to your pet to stop the bleeding and seek veterinary care immediately. It is a pleasure to inform you and help you. If you have not subscribed to the channel, you should do it now. Take care of yourself and your furry friend. A hug, and until the next video.